This is Janine Budding from MedicalFacts at the ERS in Amsterdam. I welcome you here in the city of Amsterdam. The next coming days we will have a lot of data presented on respiratory disease, and I will give you the highlights of the Congress in a short footage. With me is Professor Dr. Hiemstra, and he's telling us a little bit more about the backgrounds and the highlights on the ERS. This morning you presented at a press conference about healthy life for lungs. Healthy Lung for Lives. Can you tell a little bit more about that?
Yeah, the campaign Healthy Lungs for Life is the campaign of the ERS together with the European Lung Foundation, and it's all about creating awareness for all stakeholders involved in respiratory health and disease. So that's from family physicians to pulmonary physicians, but also the general public and patients, to create awareness about the importance of healthy lungs and ways to prevent damage to your lungs.
This campaign was started last year in 2014. And it started with the idea that it's very nice to bring over 20,000 people, professionals, to a city in Europe to talk about respiratory science and respiratory health and respiratory diseases. But it's much better if at the same time you combine that with education of the general public and patients, and tell them about the importance of lung health and ways to prevent damage to your lungs. So that was the idea with which it was started, and it's in fact one of the world's largest ever campaigns around lung health, and it's meant to be a long-term endeavor that will be also extended after this conference.
The European Respiratory Society and the European Lung Foundation stressed out that we should be more active. As you can see around me, many delegates coming to the ERS have taken the active option and walked to the RAI in Amsterdam.
What is also important is that there's a preventive thing, so regular physical activity may reduce the risk of long-term diseases. So if you look in the Netherlands, we spent 95% of our healthcare budget on treating disease and only 5% on prevention, and this is clearly something you can do to prevent the development of and also the progression of lung diseases.
Well, the important thing in this whole campaign is also to make people aware that not everyone needs to run a marathon, right? And not everyone needs to cycle the Tour de France and win it. The slogan is take the active option, and it's all about the importance of being physically active for both people with healthy lungs and also for patients with lung diseases.
During all the meetings here at the ERS in Amsterdam, it's very obvious that air pollution, mainly by black carbon, is very damaging for health and very important issue for politicians and for governments to do something about it.
We can always ask, do you really have to fly in more than 20,000 people to one place? Is that a good pollution thing? And a lot of things can be done over webinars, but we really believe that it's about the people doing the research having a possibility of interacting, discussing, creating networks, because that's how we do science.
Can you explain why the short-term exposure to black carbon is associated with increased hospital admission due to the respiratory symptoms, and that the long-term exposure is associated with exacerbations and increased prevalence of asthma?
Thank you. So we know that when you have high pollution days, particularly in central London, that we get more children admitted to the hospital with an exacerbation of their asthma. However, in the long term, we know that long-term exposure to pollution gives you more likely to develop asthma in the first place, and also to have an increased frequency of asthma exacerbations due to the long-term effects on the lung.
What is the difference between the in black carbon exposure during peaks and lows?
We know from previous studies that when you're exposed to high peaks of black carbon, that it appears that more of the black carbon makes it into the immune cells in your lungs, in particular a cell called a macrophage. And this could be associated with the longer term effects.
Today I'm here to present my pilot study, reduction in personal exposure to black carbon during commuting in London. So particulate is the major constituent of air pollution, and is one of the major waste products generated from diesel vehicles. High-level air pollution exposure to this particular matter are associated with adverse health effects, in particular respiratory problems such as increased asthma exacerbation, and increased frequency of pneumonia. To assess the pollution exposure, a handheld blood carbon monitor was used in conjunction with a GPS device. The website WalkIt was then used to choose a less polluted route. As you can see, there was no statistically significant difference between the main road and WalkIt route for total pollution exposure. This is probably due to the small sample size. And here you can see, however, there was a significant difference between the WalkIt route and the main road for the exposure of black carbon peak exposure over 10,000 nanogram per meter cube. So the results suggest that it is possible to alter your black carbon exposure, particularly peak exposure.
There are other studies that have looked at the green areas, and we do see much lower pollution levels. Particularly, there was a study that looked at Oxford Street versus the park right next to Oxford Street, and actually the levels are so much lower that it reduces the effect on lung function in adult asthma sufferers. That was published a couple of years ago.
It's very clear that there's a good relationship between the level of fine dust, particulate matter, and lung function, not only in adults but also in children, and also in birth weight. So there's multiple implications, and the important thing there is also what you see is that there's not like a safe level, it's a continuum.
During the press conference on Sunday, there was a discussion if the ERS would react to the scandal of Volkswagen.
It's quite embarrassing that it's researchers in the US who have to find out that there has been cheating going on despite all the checkup systems we thought we had in place in Europe. We have been advocating for filters. The thing is, many places in Europe there are cities where trucks have to have filters, but outside they don't. And it's like being allowed to pee in one end of the swimming pool, but not the other. I mean, it doesn't quite work that way. So we are really pushing for that. And some of you who were at the ERS meeting previously will remember that we gave the European Lung Foundation award to Susanna Jacobs from the WHO Region Europe office, because if we could just get the EU to accept the WHO limits, although they're not safe, they are lower. And that's really what we're trying to push.
Today, Tuesday, the European Respiratory Society and the European Lung Foundation have come with a statement, and the statement says following.